Running doesn't have to hurt your pelvis if you understand how to support your run with the right stability. Running is essentially repeated single leg stands, which demands a lot of coordination. The key factors that lead to pelvic pain are essentially poor trunk control and rib cage that collapses. A lot of times people are running and in their mind they're thinking, well, I want to run these many miles, or I want to run this fast, and I want to beat my PR, whatever the case may be. The criteria is not their performance and their form. The criteria is something else. So when that is the case, your criteria is wrong. We don't want to basically destroy things because we want to achieve one thing. We want to think long term. And when you think long term, it's always the form and performance that matters. When you overstride and you land with your joints locked, you do create issues. And these issues will materialize over time and lead to dysfunctional patterns of movement, which then affect your performance and can lead to pelvic floor dysfunction with so many different presentations that it can have. If you have not subscribed to my channel, please do so. I've done videos on the telltale signs of pelvic floor dysfunction, how the symptoms vary so drastically, and some of these symptoms and signs you don't even think about as them being part of pelvic floor dysfunction. So please make sure you subscribe to the channel, because I think about 2 videos. I think I do 2 videos a week. I have thousands of videos on my channel, all categorized by playlists. So it's very helpful, and they're all intended to help you understand your body, to catch yourself just short of committing the crime. So you want to have, when it comes to running, there is a weak coordination between your diaphragm, pelvis, and your feet. Your neck, your pelvis, and your feet are at a constant state of communication. Your pelvis is your center of gravity, with the spine connected to it and your lower extremities connected to it, and it is meant to move to balance you. Your next job is to hold the head, which contains your brain, and your brain performs optimally when it's balanced. So that's the role of your neck. So that dictates to your pelvis where the center of gravity is, and your ankles have to look at the structure above and tell your midfoot and forefoot how to balance you. So the coordination of these and how they connect with each other, and how the ease of connection and stability is the key. That's proper mechanics. And so some of the common signs of pelvic floor dysfunction and pelvic instability when you're running are pain near pubic bone or tailbone when you run, pressure or tension after you run, you're more one-sided dominance than the other, and your hips hike as an example. And those are just some of the things. Some of the worst cases I've seen is when the abdominal muscles and the muscles in the back that support the spine, the up and down muscles, are actually rotated because the person was tired when they ran and they did not want to stop. So they continued with that torsion that was created as a result of adaptation and compensation for what was not there. That became the pattern, and that became the how to this individual ran from that point on. So you got to be very careful. So then the question you may have is, how am I going to go about and fix this? And you always start with biological breathing. Once again, if you had subscribed to my channel, you'd know what that is. Don't worry, I will put it at the end of this video, but please subscribe to my channel so you know all the different videos that I sign. And then there are I post. Then after you learn your biological breathing, you want to go to developmental exercises. Those are the same exercises that got you from that stage where you could barely hold your head up to become a running toddler. No bands and no weights, no gyms, no guidance, and yet you were able to stabilize your pelvis, to stabilize your trunk, to have great functionality in your lower extremities, no problems whatsoever, 100% functional mobility. So you want to be able to do that, doing this, and that's the manual of movement. So we use the same manual to see where the patient's at, and we go to the same exercises to bring stability back. If you have any questions or comments, any suggestions for any future videos that you'd like me to do, please use the comment section of this video to communicate that to me. If you need help, don't hesitate to contact me. And until next time, take care.